came here, I got sick at work,
Uh-huh.
lost my job.
Mhm.
They put me on disability. I lost my insurance. I had no benefits. And my family physician recommended I come down and talk to Kathy. Kathy had me fill out some paperwork, accepted me in the program, and it's a wonderful program for people that need the help. I've got an artificial heart valve, and I've got what they call provoked seizures.
Oh, Lordy.
So they put me on disability at my young age and told me I could never work again.
Golly. But no health insurance, no Social Security or anything like that?
I've got disability,
Uh-huh.
but you have to wait 2 years after you get disability to get insurance.
And with all those health problems, then you're just
Yeah,
out,
it's just,
nothing.
yeah. And
So-
if you know anything about the medical field, it is so expensive.
Oh, yeah. Yeah.
You basically, it's really put me in a really bad bind. I don't know what I would do if it was not for Dr. Schilling in this facility.
It's expensive even if you have insurance.
Yes, yes.
Well, and he went through a really rough time trying to figure out,
What to do.
you know, and what was going on with his medical challenges. It was like they did test after test, and
And couldn't find out what was wrong.
now you did get on the charity with Ballard Health.
No.
No, you didn't.
Ballard Health is basically in the process of getting ready to sue me.
Really? For bills?
I filled out the
Charity.
financial charity assistance, and I did not qualify over $22.12. I was over their limit.
Oh.
$22.12, so I did not qualify.
As far as your income?
Yes.
Oh, Lordy.
And I'm on a fixed income with disability.
Wow, that's a weird cutoff to get that close. So what have they done for you since you've been coming here?
Well, they've helped me get all my medication. They've helped me get a lot of my medical tests I needed done that I could not afford to get done. These girls basically bend over backwards to help you. You know, if you need something, you call, and I don't know what they do or how they do it, but they get it accomplished.
Wow. So how often do you come here?
Once a month.
Once a month. And do you get your prescriptions here also?
Majority of them, yes.
They provide them to you free of charge, the
Yes.
drugs you need?
Yes.
Wow. Okay.
Well, just for clarification,
And
it is $10 to come for a visit, and that includes any medications that we have here.
Right.
If we don't have it, then we'll write a prescription, and then it's self-pay.
Right.
And if somebody doesn't have that $10, we are not going to thump them until they get it. You know, it helps us, and we also feel like it helps our patients take responsibility for their health care as well. But really, believe it or not, that $10 does help in running the operations of the clinic.
What do you think would have happened to you if it hadn't been for this clinic?
Oh, I would have probably lost everything I've got. Probably had to move in with a family member or something. I don't know what I would have done without this clinic and Dr. Schilling. He is just phenomenal.
Just the challenges that we've had during COVID, the fact that we've lost, you know, so much funding, and we've really had to scrounge. And then we have the health department is not taking new patients, so they're referring them to us. Providence is in Sullivan County. They're not taking Hawkins County patients anymore, even if they've been there, you know, since they started. So they're referring them to us. The hospitals are referring to us. And so we have an upswing in patients, but have lost funding because of COVID.
Okay. How did that happen?
Well,
Fundraisers?
yes, we always have the 5K race, $8,000 to $10,000. We have the singing in the spring, and a dollar auction, so $5,000 to $8,000, and then
introduce me to the doctor? I think I
Yes.
met you before.
Yeah.
I do fist bump in lieu of.
There you go. That's fine.
Well, yeah, Miss Christian was just telling me about the struggles that you guys have gone through with clinics.
Right.
Throughout, but I'd like to hear it from you as well. You're seeing an increased number of patients.
Yeah. And the health department can't accept new patients because they're doing all the contact tracing of. Yeah, the other big thing is the fundraising. We have fundraising that involves people getting together and stuff. We have continued to get donations from individuals and churches, and have gotten some grants, and some through the state related to COVID stuff. So God's taking care of us, and we're able to keep on going and get the medicine and supplies to take care of patients.
What are your all's needs? I assume there's never enough resources.
Right, of course, financial. We do have some sources to get some medicine through an organization called the AmeriCares that put, whatever they get in, they send out a list every week of what's available and if stuff we can use. We order it, and then we cheaper generic medicines we buy down at the drugstore, buy in stockpiles, and then and then financially we also help patients with other things like eyeglasses. The Regional Eye Center is excellent at working with us. The doctors see our patients for free, and then we can get eyeglasses for our patients at a reduced cost. Because we, like every place, see a lot of patients with chronic diseases and stuff that are just ongoing, like diabetes and high blood pressure and heart disease. Fortunately, I'm only aware of one of our free clinic patients that was diagnosed with COVID. Fortunately, he was a young man and got over it fine. At least our volumes are increasing, which increases our need for financial resources, and of course we always need people's prayers and pray for us. The one neat thing about the clinic, besides just getting medical help here, they get spiritual help too. In the evening clinic, we also have spiritual counselors that talk with the patients and pray with them and tell them about Jesus. And it's a medical mission.
Okay.